Thank you for joining today. I'm Dr. Bob Murray, the Chief Medical Officer for NextGen. So we'll start, if you don't mind, just introduce yourself and introduce Bakersfield and who you are and where you are and what do you do and all that kind of stuff.
Sure. It was a pleasure to meet you, Dr. Murray. I've seen a lot of your presentations at UGM, so just wanted to say that. Always very informative. So my name is Marina Pearson. I work at Bakersfield Family Medical Center. We're part of a Heritage Provider Network, a larger group, and we're here in Bakersfield, California. So we started using NextGen Mobile in 2019, and that was when one of our departments, utilization review, came to a couple of different departments and asked for a solution for their inpatient case management team. They didn't really have an automated, streamlined process, so they wanted to automate, streamline their charting that their nurses do when they go and see patients in the hospital, follow the patients. So we kind of started brainstorming and figuring out how to best assist the team. Some of the challenges they presented to us were that they often would have to chart off-site in the hospital, and hospitals often had poor or no Wi-Fi internet access, so they weren't able to log into NextGen application, even though they had air cards. That did not often work. So we were looking for a solution that would account for that challenge and kind of help solve that piece of the puzzle for them. Also, another challenge that they presented to us was that they work in a team and they needed to have real-time access to the charting. So each case manager would do their part for the day, and then the other case manager would take over, so they would need real-time access to that charting. So those are kind of things, two main things we have to keep in mind while coming up with a solution. So I've attended some of the NextGen mobile webinars in the past, and I like the content. It was always presented as a provider-driven workflow, but to me, the application seemed to have the features that the utilization review department was looking for their inpatient case managers. So some of the key features that I kind of popped into my head when thinking about this project were secure off-site access to patients' charts, real-time data capture, so it allowed them to connect and chart via mobile dictation, and that mobile dictation would then load into NextGen and create a chart, create an encounter, so that was a nice feature as well. So I felt like that solution would be something potential to solve their issues. Another very big key factor in considering NextGen Mobile, of course, was the dictation caching. So when they were in a situation where there was poor internet connectivity, the option of dictation caching would be beneficial to capture that charting that they needed. Job customization is a big thing too. So we knew that we could create custom templates and link them to custom jobs and allow the nurses to dictate into those custom jobs and therefore transfer the data into NextGen, into a template. So those are the kind of key features that I thought of when proposing NextGen mobile solution to the inpatient case managers. After that, we reviewed their existing spreadsheets that they were using to capture the data and transformed those into custom templates in our EHR. Made sure it made sense to everyone, had them test it out, it worked well. And from there, we started utilizing it, and that allowed us to then create custom reports. We use SSRS reporting here at BFMC and automate daily report submission to their supervisors for review. So that presented a lot of opportunity to have data that we didn't have real-time access to before. So that was another key factor of why the solution worked for us.
Okay, that was terrific. Let's back up one little step. So tell me what the nurse case managers are doing in the hospitals that involves your NextGen patients. That part's not 100% clear.
So we have a patient population that we manage. We have a hospitalist team that kind of does the admission, and then our case managers go in and kind of assist with the process. They chart on the patient every day, seeing how they're changing, how the condition is changing, the diagnosis, any daily notes that that everyone needs to be aware of to kind of manage that hospital visit. So that's kind of what their daily activity is, and they needed a way to capture it in a structural format that we could then report off of.
No, that makes sense. So these are when your patients get admitted to the hospital, either your hospital's team or whoever's taking care of them, these are the case managers that help them during the hospital transition back into your ambulatory care, et cetera. And so that's why it's important that their notes and insights and tracking and everything are available in the ambulatory EHR.
Correct. Yes, that is correct.
Awesome. All right, and then you said that you picked up the idea. The tool is usually used by providers, which is correct, but you were like, well, why not do it for this, which is awesome. I love it. And that you talked to the team and you kind of were able to transform their process that seemed like it was on paper at that time and make a custom template and then make a custom mobile job or a couple different jobs. And so you could get a workflow that sounds like it was really working for them. So, like, how quickly was it adopted? What did they say when you rolled it out?
So definitely a change for everyone. So kind of went through a couple of processes. We met with the supervisors first, demoed the idea, got their input, buy-in to the project. We then started with one template, one of their main templates that they do for every member that gets admitted to the hospital. Kind of tested that out, then created a report to make sure that we're able to produce or put the data in a reportable format that would be sufficient for them. That worked out great. So I think, after that, we kind of went through, I think they had a total of 5 different Excel, so they were using Excel spreadsheets at the time. So we've kind of recreated those Excel spreadsheet forms into a template, which is about total 5 or 6 of templates, and kind of had them start using them and get the feedback. And we did have to alter some reporting, some formatting, but overall, we did not have to make any big changes after we created the final templates. We did add some additional fields on the custom templates just to account for things like some dates that they would go in and update regarding the admission or any kind of procedures, detailed information that they would need to capture in a date format. But overall, it kind of picked up and they started using it, and so far so good. They're loving it, and I would say that even when in the office, they often use mobile just because it's easier access and it works for them and it's quicker for them. So yeah, it's been great. And one other major thing that we were able to eliminate, of course, with using NextGen Mobile is the scanning. So initially we had to scan once they do their Excel form fill out. We take the forms and scan them into patient's chart, which of course saved a lot of time for our scanning department.
All right, so what's next for you all, either with this project or with mobile or with NextGen?
So we've actually used, or we're able to go live with mobile for our SNF hospital for SNF hospital providers. So we have 2 skilled nursing facility providers. So they go and see patients in skilled nursing facilities. So they're now utilizing NextGen Mobile as well. They're one of our 2 providers that are starting to use NextGen Mobile. We're trying to expand that workflow. We actually just requested a couple more custom jobs to be created for that process. But we're just trying to expand the functionality into different areas as much as we can. And of course, any other new cool tools you guys release, we're always open to trying them out and kind of implementing. Yeah, I have a really good team of people, very creative team of people that help me with all these projects. So we're always open to new challenges. That's
awesome. So there may be folks that are watching this that, are interested in, using mobile for their, innovative service line or, using it in a non-traditional way. Do you have any advice or any lessons learned? How should they get started? What would you tell them?
I think definitely learning what mobile can do, because, kind of like with us, listening to the presentations initially, in my mind, it was mainly for providers. And then kind of learning more about the features of the application, it kind of opens up your mind to other possibilities on areas you eventually use mobile in. So I think definitely learning all the features would be a good start, and then just seeing what the need is and trying to see if that platform would fit the need.
All right, awesome. I mean, I appreciate the time. I love the novel use of mobile. I'm happy that it's helping, and feel free to stay in touch with the mobile team, and this will obviously get some visibility with them, and let them know that you're doing it in this unique way. And I think it's terrific. So congratulations on the entry and the innovation, and yeah, join the space, and look for other ways that you can get better outcomes. Love it.
Thank you. Yeah, I mean, I think with everything we went through, COVID, healthcare, just kind of reminded us that we need to be innovative, and we need to kind of use the technologies as much as we can to improve patient care. We're all in it together and trying to do our best to kind of contribute to that. So.
Love it. All right. Thanks, Marina. Take care. Have a great day.
Thank you. All right. Bye-bye.